Well, thank you so much for joining us today. I am super excited to bring you another educational webinar here at Well Beyond Breast Cancer. Today's webinar is Stronger Than Cancer, Moving Forward with Exercise, and it's brought to you by, co-hosted by Catherine. So Dr. Catherine, she's a physical therapist and lymphedema therapist. So before I jump into who is Well Beyond Breast Cancer, just a little disclaimer. Just keep in mind, this is all for educational and informational purposes only. If you have specific concerns about what it is that you're experiencing, definitely reach out to your own healthcare team. We can provide some guidance, that's for sure, but always reach back out to your team. So who is Well Beyond Breast Cancer? Who are we? So I should start by introducing myself. So I'm Amanda. I'm the founder of Well Beyond Breast Cancer. I'm also a physical therapist as well as a certified lymphedema therapist, and have been working in this field for over 10 years now. And I founded Well Beyond Breast Cancer in late 2023, and we are a nonprofit organization with the goal of improving the quality of life of the breast cancer community, so improving the quality of life by expanding access to breast cancer rehabilitation as well as lymphedema therapy. So two specialized fields of physical and occupational therapy. Our really two main programs that we offer is our financial assistance program. This is where we fund appointments of physical and occupational therapy for individuals who are either uninsured or underinsured or experiencing financial hardship in the US. And so we partner with wonderful therapists, Catherine being one of them, to provide this care to the beneficiaries of our financial assistance program. The other program that we offer are these educational webinars and workshops. So bringing you evidence-based information directly in the comfort of your home so that you can have a better understanding of maybe what it is that you're experiencing and help you essentially move forward. So really just help you gain tools that you need so that you can take control and live well beyond breast cancer. So that is who we are at Well Beyond Breast Cancer. And now I have the great honor of introducing Catherine. As I mentioned before, she is a physical therapist as well as a certified lymphedema therapist who specializes in oncology. And she is here today to share all of her wisdom about how to safely and successfully get back to exercise or restart exercise during or after cancer. So Catherine, I will hand it over to you.
Thank you, Amanda. I'm very proud to work with Well Beyond Breast Cancer. I think it's a phenomenal nonprofit organization. And thank you all for being here. Really cool that we've got international crowd here. So hopefully there's actually a lot of international research that I've been reading and trying to stay on top of for this presentation. So a lot happening even outside the US, but a little bit about me. I got my bachelor's of science in exercise science from Creighton University, which is here in the US in Nebraska. I played college soccer, and then I went on to get my doctorate in physical therapy in 2015. And then I became a lymphedema therapist in 2019. And I've done lots of, continued education for oncology, which is this PORI program. I started my career actually in the ICU in Phoenix, Arizona. And I was at a Trauma One center working with some of the most critically ill in Arizona. And I learned so much about the body. I truly, truly appreciate my experience there. And it helps me serve my patient population now. In 2019, I unfortunately lost my mom to metastatic breast cancer. And it really opened my eyes to the oncology physical therapy world. And that's where I turned my passion into surveying the breast cancer population. So I've now worked in oncology rehab for about 5, going on 6-ish years. And I started my own physical therapy clinic here. I'm outside Fort Worth, Texas, and working with women during and after their breast cancer journey, but also seeing anyone else with various oncology diagnoses. Outside of work, I have a 15-month-old boy. He's with our babysitter right now, so if you hear him in the background, there might be some background noise. I apologize. He keeps me really busy. And then for those of you that are in the United States, My husband actually plays professional baseball, and he plays for the Toronto Blue Jays. So I actually split some time, and I'm up in Toronto, Canada, throughout the year. So we are busy. But this is one of my passions, and so I'm so excited to talk about this, and exercise is one of my favorite topics. So thank you, Amanda. So just kind of a quick review. We're going to get into more about how do we tailor our exercise program, but just a general review of why do we exercise. It's one of the common denominators to lower our risk of side effects. So there's so many side effects that come with various treatments, you know, with chemotherapy, with radiation, with surgery. All of that can be addressed with exercise. But I do want to add here that is it takes a village, right? So exercise is one I would consider a large component to treating these side effects and also lowering our risk for side effects. But keep in mind, there's lots of other things to consider, such as nutrition, our mental health, being aware of any resources that you have access to, utilizing family and friends, etc. Truly does take a village. And I just like to think exercise is definitely a larger chunk of the pie here. So some of these side effects that, so some of these side effects that we can address with exercise is cancer-related fatigue, obviously muscle strength, our upper limb function, such as post-surgery, getting ready for surgery, our physical function, you know, do we need to be able to lift up our toddler or our grandchild off the floor? What is our work function? What physical abilities do we need to have to perform our job, our house duties, etc. Exercise is going to help with our sleep, anxiety, and stress. Lymphedema. In regards to lymphedema, exercise is going to help lower our risk because it's a huge support to the lymphatic system, lowering our inflammation. We'll talk about that shortly. But also, if you have lymphedema, traditionally exercise was kind of looked at as a little scary, like, oh, we don't want to flare up our lymphedema, but we know it's actually a huge support for the lymphatic system. And so it's only going to benefit those with living with lymphedema. Neuropathy, which can cause balance problems or, fine motor issues with our hands. Exercise is going to help with that. Overall improvement in quality of life, pain management. And then one of the biggest things that I don't think we talk about enough is improving treatment tolerance. So that's looking at exercise during treatment. Exercise is shown to improve our tolerance to tolerating the, chemotherapy, for example, tolerating radiation, tolerating preparing for surgery, and maybe having quicker return to function after surgery. So exercise is huge throughout the continuum of care. And as I mentioned, I've been reading a lot of research, and a lot of research comes outside the US, but actually Australia, they are really pushing hard for it to just be the standard of care. So when you meet with your team, you get your treatment plan, and you just follow your treatment plan as per your doctor, but exercise should be included in that. Exercise, in Australia, they're really trying to make that standard, and I hope one day in the US that's become standard as well. So we can move forward. So this is a lot of information. Let me break it down. I tried to find some of the research that's really only been presented in the last 1 to 2 years, something that's more relevant. We've had lots of long-term research showing, yes, we know movement is good. Yes, we know exercise is good. It's obviously good for our muscles. It's good for our bones. It's good for our mental health, etc. But I want to look at, what are we looking at now? We know that it's good, but where are we looking at it more specifically? So these are just really important things that I found interesting in the research the last couple of years. So a lot of studies are starting to show that 1/3 of women diagnosed with breast cancer are still feeling that cancer-related fatigue 3 to 5 years after diagnosis. So it kind of goes back to my last point, is if we build in exercise early on, or are motivated to find ways to move our body during and shortly after treatment, then hopefully we can combat that cancer-related fatigue and get on top of it before we're 5 years after diagnosis and still feeling it. But there's hope that if you are 3 or 5 years after diagnosis or more, and you're kind of still feeling this fatigue that's been lingering, there's something we can do about it. And that's shown in the research with exercise. We're going to kind of get down to the cellular level because I nerd out over this stuff. So lots of big words here, but all in all, the evidence we're starting to see is looking more at the cellular level of how is exercise affecting our systems, not necessarily just your muscles, just your bones. So it's decreasing our inflammation, which improving our insulin signaling, influencing our sex hormones. So we're decreasing, for example, circulating estrogen. So we have all these metabolic pathways, and we don't want, for example, a bunch of free-floating estrogen. So a sedentary, inactive lifestyle, we kind of gain a little more adipose tissue. We have a little muscle wasting. That can lead to a more bioavailability of estrogen. Now, I am not a scientist, I'm not a biologist. I find this interesting because we're just starting to look beyond our larger systems. We're starting to look at, okay, well, exercise is good, but like, why is it good? Where are we seeing it that it's benefiting at the cellular level? And we're starting to learn more about how some of this stuff is affecting whether breast cancer risk, reoccurrence rates, or tolerance to treatment, meaning how can exercise in conjunction with our treatments of surgery, chemo, radiation, et cetera, assist in getting rid of the cancer. So that goes on to the next point. This is just kind of a combo of a bunch of research articles I read. I just kind of tried to paraphrase, but the breast cancer patients, we're now seeing support on how it's influencing tumor biology. So it's improving clinical outcomes because of what exercise can affect on the actual cancer tumor itself. So it's decreasing the cancer biomarkers, it's helping decrease reoccurrence rates, it's helping improve pathological response. Some of the studies are mostly on like hormone positive trials. Still need a little more research in triple negative, but triple negative also has that inflammatory component. Going back to my last point, exercise is going to help reduce inflammation. The two big trials, the challenge trial is colon cancer related. That came out, it was released last year. It was a huge study. And it was just showing that it was decreasing reoccurrence rate and really helping survival rate. The benefit trial was breast cancer related. So similar findings, decreasing reoccurrence rate, improving pathological response, basically attacking the tumor. Before I get to the next point, or I'll say the next point and then I'll get back to what's on my mind. So another study showed that resistance training in HIIT workouts are showing huge changes in the circulating myokines and reduced cancer cell growth. So once again, we kind of suffocate that tumor, the cancer cells. We don't want them to grow. We want them to go away. We want to support our body while undergoing our treatment. In addition, in post-treatment, we want to be able to decrease our rates of reoccurrence. So exercise is going to be a huge support for that, as well as seen in this study. But we do need further investigation for long-term observations. So I think this is like a huge start. And what I'm actually seeing a trend in, I'm a huge advocate for aerobic and resistance training. But I'm starting to see a lot of the trend in research is supporting more resistance training. Now, where aerobic will become important is for our cardiovascular system, which sometimes our cardiovascular system can take a hit depending on what type of chemotherapy we've had, potentially some side effects from radiation. So exercise, aerobic can support the cardiovascular system. The reason why I say that is sometimes we can just get to the gym or get to our workout twice a week. And maybe you're just doing a resistance training program. That's okay. You're still making a change. You're still affecting your cells. You're still doing a good job. not everyone can get out and get that 30-minute walk or an hour walk, or some people can't get outside or don't have access to certain aerobic equipment. That's okay. We can just use our body weight, do a resistance program, and we're good to go. We've made a huge impact on our body for many reasons. The last point that was in my head was inflammation sometimes has become this like taboo word. I see it all the time on social media. Being a lymphedema therapist in like the lymphatic world, you see inflammation. But inflammation, not in the taboo, not in the wellness world, is tackled by exercise. And what I want to touch upon is with lymphedema. Lymphedema is an inflammatory response. And so exercise can only support that. Exercise helps pump our lymphatic system to pump out that lymphatic fluid. I actually believe in Europe, they're starting to do more like compression and exercise-based therapies for lymphedema. We're a little behind in the US on what Europe is doing with lymphedema therapy, but that is kind of what actually I think in the UK, they're starting to do a lot more of just exercise-based treatment, compression, and then MLD, the manual lymphatic drainage as needed. So resistance training is becoming more popular for good reason. So my last point that I wanted to make here, I know it's a lot of heavy information on research, but I think once we know more about the molecular mechanisms of exercise, we can have more specific criteria. So dosage, well, what exactly do we need to be doing for exercise? What intensity and what modality? What type of exercise do I need to be doing to have that cellular effect? Every body is different. Everybody's response to treatment is different. Everyone has a different type of genetic makeup with their cancer. So it is a challenging topic to tackle, but I think we're getting closer as we're seeing, and we're getting more support for exercise. I would love for it to be part of the treatment plan, but that's why all you guys are listening and hopefully going to start implementing this for yourself. So we can move on to the next one. So kind of what we follow, at least in the United States, and I think the Australian guidelines are very similar, but the American College of Sports Medicine for cancer survivors recommends 30 minutes, 3 times a week, just starting out, with the goal to increase to 150 minutes per week of moderate intensity or 75 minutes of vigorous. We'll kind of talk about what that means in a minute. And then strength training 2 days per week. And they have some more guidelines, you know, like 8 to 12 reps of like 60% of your 1 rep max. We're really getting into the strength training world there. What I tell my patients with strength training is by, you know, let's say you're doing 3 sets of 10. By that rep 7, 8, 9, you're starting to feel tired, but you want to have good form. So you really kind of want to be stressing those muscles. If we're breezing through that exercise and we get to our 3rd set of 10 and our muscles don't feel tired, we need to go up and wait, or maybe change the exercise. So that's kind of what I tell my patients with strength training, is we're fatiguing our muscles. Now, once again, there's a huge pull on aerobic exercise here. While this was based off the research and a huge meta-analysis in 2019, I would advocate for also more strength training. I would add maybe 3 days per week, but once again, we're working up to this. This is probably not a starting point, especially if you're in treatment. You know, you want to deal with, you know, what are the days you feel good? What are the days maybe you feel a little crummy? That's a rest day, maybe a light stretch day. We want to also work with ourselves. What's realistic and what are we going to comply to? I'll be the first one to say, I'll try to make my week and maybe I'll exercise once because I overload myself with so much and it's not realistic. So we want to talk about what's also realistic for ourselves. We're hitting our goals, we're feeling good, and we're not burnt out by the end of the day or end of the week. Go ahead. So when we talk about vigorous activity, moderate activity, intensity, now, of course, we could go off our heart rate, but not everybody has access to a heart rate monitor or anything like this. But this is a good little chart You can even Google it, have a little picture of it on your phone while you're, out exercising. Our goal with aerobic activity is to hit that moderate level. So if you can kind of read that, it says, feels like you can exercise for hours. You're breathing heavily, but you can still kind of hold a short conversation. So if you're out for a walk, sorry, I thought my little one was knocking on the door. If you're out for a walk or you're on the elliptical, maybe you can kind of walk and talk and have like a chat with your friend, but you might have to, hold on, I'm taking a breath here. You're kind of catching your breath a little bit. That's that, we call it 4 to 6 out of 10. If you Google, there might be some charts you find that are 1 to 20. So just kind of look, that's going to be, I think, 13-ish, 14-ish might be the moderate activity. I usually use the 10 chart. So just don't be alarmed if you see a 20 RPE chart. You can still use that one. It will tell you what levels are moderate, what levels are vigorous. So then if we get up to that vigorous activity, maybe we've worked our way up to that, you're on the verge of becoming uncomfortable, you're just breathing heavier. You might not be able to really complete a conversation, or you're can't get a full sentence out. That's going to be vigorous. That's a higher intensity exercise. So you might be feeling that more in maybe a cardio workout class of sorts, or more of a HIIT workout class. That's going to be that higher intensity activity. So for initial activity, just getting back to exercise, just focus on maybe that light to moderate range with the goal of we're trying to achieve moderate. Once you hit moderate level, meaning, right, we can kind of hold a conversation, but we're catching our breath every few sentences. Once you're there, then you can kind of start working your way maybe to maybe just once a week, you do like a vigorous activity. And maybe that's, you've got hills in your neighborhood and you're walking hills or power walking up hills. These are just a few examples of, we're not starting at vigorous unless you feel ready. Getting clearance from your doctor depends, are you 5 years post-treatment and maybe you want to get back to running, so it's all about where you are on your exercise journey and where you are with your current activity tolerance. Please throw questions in the chat that we can answer later on that, but we're going to go over some examples of what that looks like for starting out with exercise. A lot of barriers to exercise, and how do we overcome them? The biggest thing that we also see in research is its motivation. How can we motivate people to get to exercise? Sometimes we're just feeling so tired and we just don't want to get there, or it's like we just have to put 2 feet or 1 foot in front of the other and get there and get going and create a habit. So time restraints. Look at your schedule. Where does exercise fit in? Is it a lunch break? Is it, for me, I'm living toddler life right now. So maybe we're going outside for a walk because he wants to get outside. Maybe you're chasing a grandchild around the house, you're playing. Maybe you have stairs at work and you want to take the stairs. And that's, okay, I got 5 minutes in. I'll do another 5 minutes later. We're just skipping the elevator. There's other ways we can implement exercise. It doesn't always have to be okay, I've got to set aside an hour in my day. So planning ahead and scheduling movement into your weekly schedule. I think, some people like to pick a Sunday, look at your week ahead, or maybe for you it's Friday, look at your weekend and then into your next week. And maybe if you can sit down and plan it, put a reminder on your phone, put stickies on your mirror, just say, hey, Tuesday, my goal is to get 30 minutes of movement. What does that look like? 5 minutes on the stairs at work throughout the day, a couple times a day, you got your 30 minutes. Maybe it's a beautiful day. We're thankfully hitting some spring weather here in Texas. I'm going to come home from work. I'm going to take my dog for a walk. Start simple. Because if we make it too hard on ourselves at first, we're just going to get tired of it, and we're going to stop doing it. We're not going to have that compliance. Lack of interest. I always tell my patients, find something fun. Everyone thinks, oh, I need to go exercise. That means I have to go sign up for a gym, or I've got to go buy a bunch of weights. No, you don't have to. Find something that's fun. I mean, a gal I worked with, she loves dancing. So she goes to like an aerobics dance class. Sounds like really fun to me. YouTube has so many free resources like Zumba and fun yoga classes and stuff you could even do with family members, or maybe you got a friend or your partner you like to work out with. You guys can find something that you do together and you kind of have that accountability partner. So find something you like to do. We don't want to force exercise, because then, yeah, once again, we're not going to comply. We're not going to follow through with it. And maybe once you make it a habit, you say, oh, I want to try something new. Also look for other resources that are out there. For example, right, these are all just things that are in my area. There's a group that they host free exercise classes, all different types, for breast cancer survivors. And so they have tennis classes and pickleball and yoga, and people can just sign up and go do those free, and they have a community. So maybe there's resources in your area. You can connect with some people. Once again, there's more accountability, makes it fun, like-minded community. So explore, maybe your oncology offices have resources. So there's lots of other ways to find exercise that's fun. What else? Limited access to a gym. One, they can be expensive. Some people are just not gym goers. Or we don't have equipment at home. It's totally fine. Our body weight is totally a great way to start. You can start with body weight exercises. And then there's affordable ways. There's at least, I know Amazon's different everywhere. When I'm like going to Canada, they don't have as good Amazon, I have to say. So it takes like a week to get something. So, but if you plan ahead, little resistance bands and loops, and like those, maybe at least in the US, maybe run $15 to $20 for a whole pack, from like working resistance bands from 20 pounds all the way up to 50 pounds. You could do a whole workout with that. So, that's a little more of an affordable way, doing home exercises, working with an oncology or PT. I work with, or OT, I can't forget my occupational therapist. I build exercise programs for my patients all the time. And I just work with, what equipment do you have at home? Or do you want to go to the gym? If you have access to the gym, or, if you're in Pilates class, how often do you go to Pilates, and what else do you want to do around that? So working with an oncology PT or OT can help you build that program to fit your wants and needs and goals. This I hear all the time, and it's completely valid, especially with kind of, hard to say how many years we've been out from COVID, but fear of germ risk, right? We do not want to put our bodies at risk, especially when you're going through treatment. It's 1000% valid. So maybe that's when you choose a home-based workout instead of the gym. And maybe you say, after treatment, I'd like to work myself up to going back to a gym class that I enjoyed, or a yoga class, or a Pilates class, but you want to just protect your immune system, then maybe choose home-based workouts. Once again, working with an oncology therapist, or a personal trainer, or finding resources online that you can just build your own little home program. And then maybe just to kind of get yourself outside, so we're not stuck inside all the time. And instead of going to the gym, just maybe get out and get some fresh air. You could do your exercises in the backyard if you have access to a backyard, or on the front lawn, or at a friend's house if you feel comfortable going there. So there's other ways to make it fun and enjoyable as well. And just because we can't get to a gym shouldn't be a reason why we're not exercising, but it is a big barrier, I understand. And then fear of worsening symptoms. Absolutely. I still, to this day, hear from patients, especially, with lymphedema, or are worried about getting lymphedema. I'm worried I'm going to exercise and exacerbate it, or I'm going to trigger it. The positive thing is research is showing that's not going to happen. Exercise is only going to help you and that lymphatic system, in particular with lymphedema. So this would be a time maybe you want to talk to your doctor, your oncologist. If you're not seeing your oncologist as often, because maybe you're post-treatment, a primary care provider, a nurse navigator, or just your local oncology PT or OT. They can reevaluate you. Is there maybe something you'd rather work with them on first, and then they can help you work up to an exercise program, something that feels safe, a gradual exercise plan so that you feel comfortable moving into a more regulated program from home or the gym, whatever you choose. All right, so now we're going to look at kind of what does it look like during the week, and we're trying to hit those recommended exercise goals. This is a lot of repetition, so look at your schedule. Some people, well, I'm type A, so I'm a planner, so you don't have to take my advice, but I would like to say that, you know, looking at your schedule, what does it look like? Where can you fit that time in? And then what do you enjoy doing? First look at, well, I know I can get outside this week. I can get out twice a week. Great. Mark it in your calendar. And maybe it's not a specific time, or if you're like me, I'm like, okay, I know, you know, my toddler's awake at this time. I'm going to go walk then. Or maybe it's just, hey, my goal today is just 30 minutes or 20 minutes or an hour. So identifying what you want to do, putting it down in your calendar, and make it realistic. If you are in treatment, you know, maybe, you know, some people have those couple days after chemo where you just don't feel great. Okay, your priority those days are resting. Maybe some gentle stretching at home, some breathing exercises. Put that down. Understand that. Do not be hard on yourself if you're not exercising those days. Then the days you're feeling good, go ahead and say, okay, today I'm going to go walk. Or, hey, my girlfriend, she wants to grab lunch. We're going to go grab lunch and go for a walk afterward. Whatever works for you. Or I really want to get back to Pilates. I'm going to go to my Pilates class. Make it realistic for you. And then adopt your schedule as needed. So as we're like, hey, you know what? I've been doing this for 8 weeks. I'm doing really well. I've had like a flow. I'm getting my 2 to 3 times a week of exercise. I'm feeling really good. Maybe then now we start to progress into that next level of, can we do, you know, increase our time? So maybe instead of 20 or 30 minutes of an exercise, we're doing 50 minutes, or we're trying a class, or higher intensity exercise. Then you can start kind of improving your schedule and your tolerance to exercise. Okay, so let's talk about like what that looks like. I've been saying a lot of these things of 20 minutes, 30 minutes, this day. So let's kind of look at what this looks like. Now, I just want to, before I jump into the details, I picked all sorts of random exercise types, trying to be somewhat realistic. I know not everybody has access to everything I've mentioned in these. I'm just trying to give examples. So once again, feel free to ask questions about what you have access to, and especially, you know, in other countries, you guys probably have access to lots of other things that we don't have. So looking at your resources there would be good. So this is going to be, we're working up to those guidelines, those American College of Sports Medicine guidelines. So remember, the first level was just 30 minutes, 3 times a week, working up to that 150 minutes per week. So this is, we're just starting our workout program again. Maybe we're in the middle of treatment, or we're just finished treatment. We just haven't done a whole lot in a while, and we just want to ease our body back into it. Here's a gentle example. So maybe Monday, you're just going to go for a walk, but we want to look at that RPE level, right? We still want to challenge ourselves. So maybe we're just kind of doing an interval walk where you know, go for a nice comfortable pace. And then maybe for 1 minute, you pick up the pace and do a power walk. And then you go back, walk slowly, comfortable pace for a few minutes, then go up, do 1 minute of an interval. And we're at that RPE, that rated perceived exertion, can't talk, of 5. So we can have a conversation, but we're taking a couple breaths, maybe every few sentences. And then maybe that day we add our strength workout. We have a handout maybe from our oncology PT, and we're doing some upper body strength exercises, whether that's body weight or we have some bands at home. Then Tuesday, we're going to rest. Wednesday, once again, not everyone has a Peloton bike or treadmill or something, but this is just an example. Maybe you're going to jump on the Peloton bike or treadmill for 20 minutes. You're just going to do the beginner class. Once again, maybe looking at a higher intensity, that's 7. 20 minutes on a Peloton bike, you know, we're breathing hard, okay? Or if you're doing a gentle cycle, maybe you just have a stationary cycle at home, getting that breath up by RPE 5 to 7. And then we're going to add our lower body strength. So if we're on our Peloton bike, we hop off, we're going to do like a Peloton strength class for just lower body. And so we've had our 2 strength workouts for the week. Then Thursday, we're going to do another 20-minute walking, that interval, slow, fast pace. Once again, getting that RPE of a 3. And then maybe we'll finish up with just some breathing exercises. Friday is a rest day. And then the weekend, just active rest. Just the goal is to get out. Maybe I'm going to walk my dog for 20 minutes, maybe 30 minutes. It's a beautiful day. So this is, once again, you don't have to break it up like this. I'm just showing examples of this is maybe how we can start to meet that 20 to 30 minutes 3 times a week. And then we're going to try to progress to that higher amount of exercise and higher intensity, which I'll show you in the next slide. So once again, this is something we're working up to. So this is maybe after 3 months of starting with just the 3 times a week. I will say I added a lot more to this just to give more examples of if people do like to go to group classes, gyms, whatever. So once again, this is just examples, and I would want you to pick something that's best suited for you. So on Monday, maybe we have a gym strength class that we like to go to. Like, in the US, we have Orange Theory and F45, and some of those are pretty intense. Some people have like the big, like a Lifetime gym, and you have like lots of classes there. So we're going to go to that class 50 minutes. But this class, I'm wearing my heart rate monitor, and I'm going to get 60 to 70% of my max heart rate. Now, that might be something you ask your oncology therapist for help, like what heart rate am I trying to get to? And that's something that they can help you with. So that's a pretty intense class. So then Tuesday, we're going to take active rest, just a nice gentle walk with the dog. Wednesday, we're going back. We're going to do our HIIT class. So that's a little bit of strength, a little bit of cardio. Once again, I'm watching on my sport watch. I'm hitting that heart rate max of 60 to 70%. Thursday, we're chilling. We're going to do just a gentle, well, sometimes those flow classes are hard, to be honest. But like maybe a yin yoga or something relaxing, or restorative yoga class, a mobility day, or just stretching at home, maybe do a YouTube yoga class. Or maybe it's a rest day. Friday, 30-minute interval walk, trying to get that higher intensity, RPE. And then we're just going to do a 20-minute body weight strength workout at home. And then the weekend, 20, 30-minute walk with our partner, our family, our friends, our kids. Get your hot girl walk on. So this is just a more example of how we went from 30 minutes 3 times a week, or 20 minutes if we're just starting out. And then this is going to be, we're working up to that higher intensity. So you see, right, we're hitting that 60 to 70% max heart rate. That's going to be that higher and moderate to vigorous intensity, or that RPE of 6, 7. So we're breathing pretty hard. We cannot really finish a sentence, but we're working up to this. And the goal is 150 minutes per week. It's a lot. It is a lot. It is hard to build that into a schedule. So I don't want you guys to be hard on yourselves if you're not getting there. Maybe you're just doing a HIIT workout once a week, and then the rest of the week you're just walking, but power walking, doing intervals. Maybe you have some hills in the neighborhood, going on a hike, something like that. These are just examples of things you can do to achieve that higher intensity. So lots of tools out there. There's so many. I mean, I could have just like listed hundreds, to be honest, but these are a couple that I'm aware of and that some of my patients use. So Peloton, you don't have to have the equipment for it. I think the app, if you just get the app, might be $30 or $40 a month. So like that could be like your gym membership. You can look at, if you're not going to a gym and don't prefer to go to a gym, you can look at these apps as like your gym membership, and that is probably going to be cheaper than a gym. So that is a paid app. Evlo, I put this one on here. It is a little more expensive, but I've trialed it myself. They do like, I think it's 4 weeks free. It was made by physical therapists, and I love their workouts. They do have body weight exercises, and then they do have some with like dumbbells, some equipment. It is a little more expensive, but I do love their workouts a lot. And there also is a lot towards pelvic floor therapy, which is also important in the breast cancer world. Nike Training Club is a free app. Fit On, they have multiple membership options, and the basic one is free. I use that one. It's been years and years, so I'm sure it's only gotten better. And then you guys, ChatGPT, take it with a grain of salt, but like, so you can't trust everything ChatGPT says, but I had ChatGPT create my workout program. Like I said, here's my schedule. This is when I'm at work. This is when I'm at home. This is, this is my schedule. This is what my goals for the week. Can you tell me when to work out? And ChatGPT made me actually a great plan. And then I even said, oh, like, I don't want to think about my workout right now. Can you, maybe Mondays I want to do legs. Can you make me a little leg workout program? This is the equipment I have. Do not knock ChatGPT. My disclaimer on that is, of course, if you have any issues with side effects, please talk to your providers and please talk to your therapists, your oncology PTs and OTs. You can even take your ChatGPT findings or Gemini, or there's all these other ones out there, and bring them to your therapist and say, this is what we came up with. What do you think? How can we change it? But don't knock it, and it's free. Heart rate trackers. You don't have to have a heart rate tracker. This is just if you so choose. Sometimes it can be beneficial if we are watching for any history of cardiotoxicity to chemotherapy, any cardiac history. But that would be something you're working with your provider and your physical therapist on. But a pulse ox, that's just, you can get them at the drugstore usually. They just clip onto your finger. You see them at the doctor's office all the time. That would be probably a pretty affordable option. There's the basic Fitbit, has, track your steps, track your heart rate, those. And there's all different variable or various types of heart rate monitors. And then of course there's the more expensive ones depending on, how intense you're wanting to track your activity. If you're tracking your steps, you really want to have more data on your watch. There's Garmin's, Apple Watch, etc. Exercise equipment, once again, you can just find stuff at home. But if you want to have a couple things at home, I talked about resistance bands and resistance loops. Those are like the loops that you can see people put around their legs sometimes. Yoga mat, totally optional. Dumbbells, you can find those, sometimes are secondhand sports stores, or like I said, Amazon, Walmart, Target, various stores. Maybe you only want 2 pounds, 3 pounds, 4 pounds. And then you can work your way up to the higher weights. Kettlebells, that's actually in the picture in the middle, that's a kettlebell. Walking pad, those are going to be more expensive, in a treadmill, stationary bike, ellipticals, all of those things are cardio equipment. It's going to be more expensive if you so choose to build a mini home gym. Maybe that's something you're working up to. But a walking pad is a great way to get your steps as well, if that's something you want to invest in. They don't go super fast, so it's not, you might not be getting your heart rate up, but if you're like a step tracker and a person who likes to track your steps, it's a good way to do that at home if for some reason you just can't get out of the house enough. So we're almost finished here, but things to consider when to see an oncology PT. So I've said a lot of these things already, but experiencing any side effects. So including, but once again, not limited to, if you're having that fatigue, that you wake up tired and you just can't get through your day, that fatigue that's a little more crippling, it's not satisfied with rest, please, talk to your oncology PT or OT. Lymphedema, axillary web syndrome, which is that cording that can happen in the armpit or trunk or breast region. If you're having troubles with shoulder mobility and strength changes, whether that's post-surgery, post-radiation, and of course, pain. We don't want you to be pushing through any pain with exercise. Muscle soreness is okay. Pain is different. If there's any bone metastasis present, you want to make sure that you are having an exercise program tailored specifically for that situation, because some exercises can put the bones at risk for fracturing. So you just really want to be mindful of any bone metastasis. So please talk to your doctor and oncology therapist about that. Needing help creating an exercise program. I don't know where to start. go see your oncology PT. They can do an evaluation, say, hey, you know what, you're doing great, your range of motion is great, let's just build you a program. Or maybe they say, oh, you know what, I see some tightness with your shoulder mobility, let's do some PT for a few sessions, and then we'll work you up and get you going on an exercise program. Any balance challenges, whether it's from neuropathy or just generalized weakness or just deconditioning, please see a therapist on that, just to make sure that as you build an exercise program, it is safe for you and we don't put you at risk for falling, any complications. Because one, we don't want you to fall and hurt yourself, and we don't want you to then hate exercise because it puts you in a vulnerable position. Assessment for safe return to higher level exercise. Maybe you really like running, you really like CrossFit, and you want to get back to that. We want to make sure that you're gradually getting back to those higher intensity and impact exercises. And I've mentioned it already, cardiovascular considerations. If there's any cardiac history, sometimes chemotherapy can cause some cardiac side effects. We just want to make sure that you're safely progressing your exercise. And maybe, for example, we're not going to go as intense on that heart rate. We're going to kind of keep it lower so we're not stressing the heart too much. And when to stop. Persistent pain beyond that muscle soreness, pain that's waking you up at night, something that obviously you don't want to be pushing through an exercise, dizziness or fainting, severe shortness of breath. Just, if you can have that conversation and you're just kind of catching your breath, and then if it comes back down to normal, that's a normal exercise response. But if you're just having severe shortness of breath with very light exercise, you're just out for a walk and you just cannot get 2 words out, please see your doctor. A sudden onset of swelling, that would be maybe you just woke up tomorrow and your arm is very swollen. Please see your doctor about that. And then any new chest pain, of course. These are just some of the references of all the research that we added into the presentation. And I think it's Q&A. Sorry, I went a little overtime on there, but I think we still have a couple minutes for questions.
Amazing. Thank you so much, Catherine. So I think there are some questions in the chat already. Let me see if I can pull up that chat for you. So one of the questions we received is self-massage helpful in addition to exercise? I'm wondering if this is probably for lymphedema.
Absolutely. Self-massage, if you have lymphedema, definitely I would review that with your oncology PT or OT. So learning how to do the manual lymphatic drainage. It's not going to hurt anything as long as you're cleared by your doctor and there's no other conditions to be aware of. Self-massage or going to get a massage or going to your therapist for manual lymphatic drainage definitely is going to be beneficial with exercise. You want to keep those muscles loose, and especially if you get into an exercise program, doing self-massage, whether it's lymphedema related or lymphatic related, is also going to help with your recovery to exercise. So if there's something more specific you're looking for, please throw it in the chat or ask. Are you maybe looking at like lymphatic drainage exercise or massage? My brain's on exercise.
Yeah, so if anyone has any questions, like I mentioned earlier, please feel free to either leave them in the chat or, this is a very safe and welcome space, so you can just unmute yourself and ask Catherine your question directly, whatever works best for you.
I unmuted myself. Can you hear me okay? The headset I have isn't the best.
I think so.
Okay.
I think so. It's a little muffled.
Okay. My question is, with compression garments, if we're exercising, should we wear them when we're exercising or not? Is there any research on what's better?
Yeah, that's an excellent question. Do you have lymphedema? Or, well, you don't have to reveal that. I'll answer both.
It's okay. I have, it's like beginning. I just have the fullness and the tingling on this left side that was radiated. So I'm not really showing too much swelling or whatnot, but I feel like I have something like under my arm, like under my armpit all the time, sort of situation, if that makes sense, and the tightness. So,
Okay. Yeah, thank you
yeah.
so much. Thank you for clarifying and thank you for your question. It's a great question. We do get that as lymphedema therapists. I'm sure Amanda gets that a lot too. So I'm going to go backwards a little bit. If someone does not have lymphedema, they don't necessarily need to work out with compression. But as you mentioned, you know, some beginning signs of lymphedema or someone who is progressed in lymphedema, I would say wear your compression while exercising. And the reason behind that, and Amanda can also pitch in her opinion as well, but the reason behind that is as we're exercising, we have multiple forces going on here. So not to get all physics on you, but as our muscles are pumping, we have an external force going against the compression, okay? So that compression is working against that muscle as you move and breathe and et cetera, et cetera. So as that physics, as those forces are coming together, it's putting compression or pressure, I should say, on the lymphatic vessels to pump fluid out. So that's where compression is going to be important while exercising, because we're using those both forces to pump the lymphatic fluid out, which is what we want to do with a lymphedema situation. So I hope that answers your question. And the other part of it would also be, you know, checking in with a lymphedema therapist to make sure you're wearing the proper garment, it's fitting properly. Because some people will say, oh, I worked out in it and it was like so painful and it was hurting and cutting me off. So you just want to make sure you're in the proper garment because there are different types of materials out there that some are better than others depending on your shape, your size, stage of lymphedema, etc.
I have another question, if that's okay.
Absolutely.
It has to do with self-massage. I know somebody asked, but in an effort to in the massage to move anything more down my side and more towards my back instead of towards my armpit area, I find it difficult. Are there any tools we can use to assist with that?
That's a good question. I would say it might be hard to answer just given you're not my patient, so I don't want to suggest anything without knowing your situation. I don't know if you have access to a therapist, but maybe Amanda can chime in. I know YouTube, and there's a lot of great therapists on YouTube that have good self-lymphatic drainage videos. But it is kind of hard to do some self-MLD in certain areas, but maybe Amanda has a better answer.
Yeah, I know some of my patients will look to getting maybe a very, very soft to dry brush with a long handle so they're able to reach like hard to reach areas. But like Catherine said, I'm super happy to connect with you, to help you connect with a therapist within your community and just provide more guidance. But that's usually something that a lot of my patients will do. Of course, our hand is the most effective tool that we have when it comes to self-massage, and that really should be your main tool, but I get it. For those hard to reach areas, we can rely on other tools like a soft dry brush.
Yeah, that's a good suggestion. I like that one too.
Are there any other questions?
I think I saw some in the chat. Come back.
So in the chat, in regards to the self-massage that we had answered earlier, they said, I'm at high risk for lymphedema related to removal of 13 lymph nodes. So I do what I can as preventative. No lymphedema yet. That's why I was asking about self-massage.
Thank you. I appreciate you clarifying. Yeah, so self-massage, absolutely, in regards to decreasing risk for lymphedema, absolutely is going to be beneficial. Exercise, I truly also believe is going to be just as important. And in that type of situation, maybe it's you're doing, you know, I don't want to single out yoga because not everyone's a yoga person. I'm not always a yoga person, but working on range of motion. So really working on that shoulder mobility, whether it's a yoga, Pilates, or just some kind of stretching program that you develop. And that could be implemented into your program if you do your self-massage, you do your, shoulder range of motion, some breathing exercises, and maybe a little, your upper body strength training. Because as I was mentioning with the other question with wearing compression, exercise is such a powerful impact on those lymphatic vessels. And so I think all of that in combination with your self massage is like an excellent program.
Great. Are there any other final questions before we wrap up today's session?
Our vibration plate's good. I've got all the questions. Sorry. Our vibration plate's good to help with that also.
Yeah, same thing. I don't know if there's like legitimate research out there to say, oh, I found an article of like how it impacts the body. But the theory is, and Amanda, you might know more than myself, but kind of that. I love using vibration when treating patients. But with the plate, it's like the theory is it's shaking and kind of opening and closing those vessels to help pump fluid. So I don't see any harm in it. I've seen lots of people that have had benefits. Amanda, do you have any other specifics on vibration plates?
I would agree. There's not much research. It's a very relatively new tool that we have. But what I just tell people is if you're looking to support your lymphatic system, any movement is beneficial. You don't have to invest in all of these crazy trendy tools that are out there. We see so many things like the rebounder as well. One is not better than the other. As Catherine mentioned, just find what you love to do and just move a little bit every day. That's the best way to support your lymphatic system.
Mm-hmm.
Thank you.
Of course.
Thank you for your questions.
So we're going to wrap up today's session. Just a huge thank you to all of you for joining us. Again, these are educational webinars that we hold monthly, and we have one coming up in March all about breast swelling and lymphedema. We've done previous webinars on lymphedema. You can find those on our website. We know this is a really huge hot topic for a lot of people. There's a lot of misinformation out there. So you can find some really reliable resources on our website. The webinar we have coming up in March, like I mentioned, is breast swelling and lymphedema, very, very specific, because we know that it's something that a lot of people experience. But you can look forward to these monthly webinars. We have many, many others planned for the year. If you ever want to reach out to us at Well Beyond Breast Cancer, you can connect through our email address, which is there, or through social, whatever works best for you. We are always very, very open to connecting you with therapists within your community or just providing more resources. So, we are here to support you in whatever capacity. So thank you so much for joining us, and we will see you all hopefully on another webinar. Have a good one.